Hi everybody, I'm Pat O'Connor and I'm sitting up here in sunny Scotland. I only wish they were part of the Epilepsy 12 project, and hopefully with a bit more contacts we'll make sure they join in the UK data. It's been an absolute privilege to be part of the EQIP programme. I've been working in quality improvement for around 16, 17 years, and the challenges that the teams in this particular collaborative have overcome, not just trying to keep the virtual environment going, but with the onslaught of COVID. And you'll hear all about that shortly. It was just absolutely fantastic. I'd like to give thanks to Emma, Calvin, Mel, Helen, Perry, Merrick, Richard and Colin, and every single person in the teams that took part. It was just amazing. And it shows you from Colin's presentation this afternoon, the scope. When you engage in the Epilepsy 12 audit, you can see where the improvement opportunities are and can see where improvements taking place through the data that Colin presented. But the whole scope of this particular collaborative was around scale and pace. People know how to improve their services, but what we wanted to see is, could we increase the pace of that? And could we look at the scope and scale of the work that they were trying to do to make services better? Because we're all doing that. And I think the 12 KPIs give you a real hook to be able to do that. And the focus of individual team activities was around the how to improve. How can we do this? And how can we share it with a much larger group, not only outside our local teams and multidisciplinary contacts, but right across the country? And how can we keep our improvement relentless across that? I think Helen's got a few slides just to share with you what the overall objectives of the programme were. Yeah. So this slide here, good picture of Richard and I when we were way back at the beginning. It feels like a lifetime ago, and we really wanted to bring people together in a training programme to share their supports in epilepsy care and to work together across the country. So first, care, and hopefully it won't be the last, because you're going to hear from each of the 12 successful teams, and you're going to hear a selection from the 12 successful teams that were chosen across the country to participate. So there were many more than 12 that applied to be part of the programme, which was absolutely fantastic. Next slide, Helen. This is just the aims and objectives of the programme. Hopefully the participants know all about that, and certainly the RCPCH team put these together in conjunction with voluntary services, etc. And you can see what they were trying to do. It's really about ongoing advice and support and implementing change that has interventions that we can measure the access and impact across these difficult services to provide, actually. Next slide, Helen. Really thinking about how would the programme benefit me and my team. This was shared with the teams as part of their application process, and it was all about that increased sense of individual and team ownership and leadership, empowerment to improve services. It didn't take much to actually motivate them, because we were absolutely overwhelmed by the enthusiasm at the two-day event we held in Birmingham. Next slide. And of course we launched, as I said, in Birmingham. This slide is only full of factual information. It was way back on the 16th and 17th of November 2019. It certainly, for me, feels like a lifetime ago. The world's changed so much since then, and some of it in a very positive way. I think in some respects COVID had a positive effect on this collaborative. Here's wonderful photographs of the residential training weekend. You can see how smiley we all are as part of the process. It was fantastic. Next slide, Helen. This is a wonderful slide of the outputs. We've just had a celebration event for the collaborative where every single team presented the data, and every single one of them could show an impact on not only on the patients and families, but actually on the service and themselves as individuals. And we're going to hear a bit more about that very shortly. So I think, I'm not sure, Helen, I think this is the final slide actually showing our 12 teams. And again, look at all their happy, smiling faces. It was just wonderful to be part of this community. And I'm so looking forward to hearing from them this afternoon.